And here we are. We're about to get ready to do a blepharoplasty. Well, it's a blepharoplasty. That really means eyelid surgery. In this situation, we're doing a blepharoplasty of upper and lower eyelids. And why are we doing it? Well, there's certain concerns that we have here. You know, he's a pretty active guy, very healthy, very athletic, and he wants to enjoy his life, and he wants to look the way he feels. And he feels young and wonderful. But his eyelid is saying a different story. They're all heavy on the heavy side. He have gorgeous eyes, but they're being hidden. And we just want to open up the area so you can really see his eye and really appreciate it. And why is it being hidden? Because we have excess skin here. And there's this, yeah, in the male brow, we also look at his brow too, because in the brow, we also want to have a nice, even, flat brow. There's a little bit of droop in the tail here, so we will also address that droop in the tail. And so that's one reason why, because we're getting rid of excess skin. But a second reason actually why I'm doing this too is because if you actually look in the corner here, there's a little fat pocket. We want to get rid of that nasal fat pocket. So we want to create a nice even crease. So we're addressing the fat pocket, we're addressing the skin, we're addressing the tail of the brow and the upper eyelids. And the lower eyelids actually is almost the same situation, except we have fat and we also have skin here too. Not so noticeable right now, but if you notice, he also have right over his malar fat patch in this area right here, there's a little bit of puffiness, and sometimes I can act like a sponge, absorbing fluid. So we want to address that. We want to tighten the skin up in this area, so we will get rid of some excess skin. This is a pinch blepharoplasty, but we need to get rid of fat. But we want to minimize the amount of incision and size of the incision. So in that situation, we're going to get the fat from, if I actually pull this lower eyelid down, we're going to go inside and get the fat from the inside area. And once we finish that, then we'll come around and we'll get a little skin pinch and do that here. Sometimes I would do this using a CO2 laser, but due to his pigment, I don't want to do it in him. So therefore I'm doing a skin pinch in this gentleman. But that's what it is, upper and lower lid blepharoplasty. Thanks guys, appreciate it.